possibly life-threatening disease that most of us are at risk for is melanoma. Oncologist Dr. Edward Wagner of Hoag Memorial Hospital Presbyterian in Newport Beach tells us the warning signs of this silent disease and what we can do to prevent it.
Melanoma is cancer of the skin, a particularly aggressive form of cancer of the skin. The cells that manifest melanoma are melanocytes. They're skin cells that exist to pigment skin, and they exist just below the surface of the skin itself. Warning signs for melanoma are very well documented. We like to call them the A, B, C, Ds of skin cancer, of melanoma in particular. A is very important to ascertain. It's called symmetry. Anything that is a mole, a dark brown skin lesion, normally inhabits your skin. Now, if it's asymmetrical, which means it's irregular in size or contour, that's a warning sign. B stands for border. Irregular border on a mole or a dark skin discoloration is very concerning for melanoma. C, in terms of color, is very important to note too. Normal moles are brown to slightly black. Melanomas can be any other shade of black. They can be blue, they can be red. So it's important to notice any change in a color of a skin lesion in particular. D is diameter. Diameter means how big around it is. If it's 6 millimeters or greater, such as something that's 1 pencil eraser thickness width bigger than that, that's very concerning also. Something else we like to talk about is something called the ugly duckling sign, and that means that anything on your skin that's dark in color that looks ugly. That's important to note too. All those are warning signs, and all those should be pointed out to a physician. The diagnosis is always made on a biopsy, and it's an excisional biopsy that's the most proper diagnosis to make. One should never have a mole that's concerning for melanoma shaved or burnt or scraped or frozen off. They should always have an excisional biopsy of any concerning mole. The treatments that Hoag offers for melanoma treatment is basically an early detection skin program. It also involves with dermatologists and local doctors that can easily identify skin lesions that are concerning. The other things that Hoag offers is surgeons that do the sentinel lymph node biopsy procedures, and also doctors that are very familiar with immunotherapy and biochemotherapy. We're even starting to look at more specifically, more targeted anti-cancer therapies that are just starting to come over the horizon now in other cancers. Things we call tyrosine kinase inhibitors, and what those are very small molecules that can actually inhibit an oncogene on the surface of melanoma cells and cause it to either die off or kill itself off, or cause the blood supply to that tumor to die off, or any combination thereof. What increases anybody's risk for melanoma is some of the risk factors. A lot of intense sun exposure at an early young age. Those people that are more at risk for skin burning, such as the fair skin people, blonde hair, blue eye, very, very fair skin. If you burned a lot when you were young, even with very little sun exposure, that's a concern. That's definitely a concern. The best way to protect yourself against skin cancer is try to know your family history. That's the first thing you can do. The other thing you can do is, especially if you have fairer skin, is to cover up. Definitely put the highest sun protection fraction you can on your skin early on in life. That means parents who have kids in Southern California need to be aware that it's a lifelong risk of melanoma. It's not just the fact that somebody's going to get a skin burn tomorrow and have melanoma by the age of 12, is that it could increase their risk well into their 30s, 40s, and 50s. So parents need to cover their kids up at the beach. And no burn is a good burn.